No, I understand people who have chronic diseases that is not visible to everybody. Look at me, I don't look sick. I am Dr. Epub, your lifestyle boss, and welcome to my channel. Hi everyone, I am Dr. Epub. If you don't know me yet, I am a Filipino doctor and a lifestyle medicine specialist. So for this first vlog, I'm gonna share something personal and something important. And I know by sharing this experience with everybody, it will bring awareness to this disease. So not all people who know me, my friends and family, know that I am living with an invisible disease. And this invisible disease is what we call systemic lupus erythematosus or lupus. So what is lupus? Lupus falls under autoimmune diseases, and autoimmune diseases occurs when your own body would attack itself, not just attacking viruses and bacteria, but also attacking the healthy tissues and cells, causing a systemic inflammation. So other diseases that fall under autoimmune diseases would be rheumatoid arthritis, multiple sclerosis, psoriasis, even inflammatory bowel disease. So there are a lot of autoimmune diseases aside from systemic lupus erythematosus. There are a lot of people who suffer from lupus, and it occurs most commonly in women. So there is a 90-to-10 ratio, and it usually manifests at ages 20 to 40 years old. So lupus would usually manifest or would flare up if there are triggers, and the common triggers for lupus would be number 1, stress, number 2, sunlight exposure, number 3, infection from viruses and bacteria, number 4, poor diet, and number 5, prolonged use of certain medications. So the symptoms of lupus would be mouth ulcers. It could be some skin rashes like the butterfly rash, which is a telltale sign of lupus. They could have signs and symptoms in the heart and the lungs, which would usually be at severe form already. They could have gastrointestinal symptoms like acid reflux or abdominal pain. They can have joint pains, muscle pains, which are very common. Also signs and symptoms in the kidneys like blood in the urine, having anemia, high blood pressure, and having terrible headaches, migraines, having hair loss, having low-grade or high-grade fever. So you can see that the symptoms are very broad. They can be mild or severe. They can appear gradually or suddenly. So 2 cases of lupus are not the same. And usually lupus patients do not have other physical manifestations like the skin rash. That's why I call it the invisible disease. So to diagnose lupus, it would actually take a long time because there are a lot of diagnostic tests and laboratory tests that need to be done. For example, the best screening test would be your anti-nuclear antibody or ANA. And patients who are being considered for lupus have to satisfy certain criteria. Until now, there is still no cure for lupus, and the treatment is focused on modulating the symptoms. So that is why this disease is something that would frighten patients and can be life-threatening in certain forms. Just to share to everybody how my story started. I was a very sickly child since I was young. I've been in and out of the hospital when I was young for different infections, and I would always see my doctor almost every month. That was the reason why I wanted to become a doctor also in the first place, because every time I see my doctor in her white coat, I would instantly get better. And I was so inspired that she had that magic. Whenever, you know, she sees her patients, they become better, they become well. And I wanted to have that same effect with other people as well. So I got into medicine even though I was a sickly child, and through med school I was still sick. And I just really wanted to understand what was going through my body, and I wanted also to help myself and also help other people who are suffering, because I understood what they were going through. And residency came. Alright, I'm already a doctor. I passed the board exam, and residency came, and I wanted to be an emergency physician initially, because I wanted to be a cruise ship doctor. However, since the start of residency, I've never been or never felt so sick in my life. I was sick almost every week, every month. And one day I was walking to duty, and everything became so blurred. And I asked my co-resident, who was with me at that time, is it foggy? Because everything seemed so foggy. But you know, it wasn't foggy. It was just me. And the next thing I know, I was already in a stretcher. I was a patient. So instant change of roles, from being the doctor who's giving the medications, who's trying to treat people. I was on the other side of the table and being treated by my colleagues. So it took a total of 2 months for the doctors to figure out what was going on with me, because doctors would usually have to rule out other diagnoses first. I had to go all through those diagnostic tests, MRI, CT scan, and I experienced what it is like to be a patient waiting for your doctor for several hours, and having that anxiety and just wanting that assurance from the doctor that it's gonna be okay. You know, at that time I forgot I was a doctor. It's really different when you are experiencing a disease firsthand, when your body's going through it, and it's just something that you read in the books. And I never have appreciated my patients until that time that I actually experienced what they had to go through waiting. When my doctor told me that I had systemic lupus erythematosus, and just those few seconds with those 3 words, my dreams were all shattered. I am a person who has always planned everything in my life, but at that time I thought, I'm done, this is game over. I can't be a doctor anymore, because I knew the implications of having systemic lupus erythematosus. You know, one of the triggers of SLE is infection. And of course, as a doctor, is there any specialization out there that is not being exposed to infection? If you're in the hospital, you're exposed. If you're in the clinic, you're exposed. Even being a dermatologist, you're exposed to infection. So what is left for me? And I felt nothing. For the first time, I had nothing. It was just blank. And so I had to resign from residency, although it was really hard for me to do that. And I wanted to finish residency. I had to do so because I had to put my health as my #1 priority and not my career. It took me months to recover. I had never been so weak. I felt that my body was frozen at times. You know, I think a lot of lupus patients would relate to me that you would wake up in the morning having morning stiffness, literally feeling that a truck run over you. Muscles are painful, your joints are in pain, and I couldn't do the same things I would do before. Even walking, it had taken me weeks before I would be able to walk to the mall. And so I went to the States and recovered with my family. And when I was going through my phone trying to look for something that would give me hope, maybe a career, an alternative career, I stumbled into lifestyle medicine. And that time there was a course offered in Harvard Medical School in Boston. And I wanted to take the course not just because I wanted to have a career in it, but I wanted to learn about it for myself. Because, I have been an obedient patient. I went to see my doctors, I would go to my checkups, I would drink the medications they would tell me, and I knew those are the medications for SLE. I thought to myself, is this it? Is this at a young age I can't do what I want to do? Maybe there's something that I can do on my own aside from drinking these medications. And there, I found lifestyle medicine. So I went to Harvard Medical School in Boston. That was a dream come true, imagine. Because of this situation, I was able to go to Harvard. And my parents were so supportive of me, and we flew to Boston. Although I was feeling sick that time during the travel, I pushed myself to do it. And when I heard about the lectures, there I found my answered prayer. There was the missing piece to treatment, to management, it was an answered prayer, a way for me to be able to help myself feel better. So lifestyle medicine focuses on the lifestyle of a person. It's used as a adjunct therapy to a lot of diseases, chronic diseases, wherein you focus on your lifestyle, such as nutrition, your physical activity, your sleep health, managing your stress, removing vices, even your mental health, positive psychology, and connectivity to other people. With lifestyle medicine, I discovered that lifestyle therapy is actually part of the treatment algorithm for lupus. And I've realized that lifestyle intervention, lifestyle modification is always present in the prevention, management, and rehabilitation of almost all diseases. And I found this journal that says that the impact of diet can trigger or alter the course of the disease. Proper diet can help preserve the body's homeostasis, increase period of remission, prevent adverse effects of medication, and improve a patient's physical and well-being. I wouldn't want to claim that I am a success story because every day is a battle. It is not something that I was able to change overnight. It was a gradual change. It took me 2 years. And I understand people who are undergoing this disease because one of the symptoms is depression. Believe me, I had cycles of depression, and it took me how many years for me to be able to speak about it and even to accept that I have this disease. The reason why I'm doing this because I have experienced it myself that it is possible to obtain strength from other people. For me, I obtained my strength from people who also suffered from the same disease, from people who are like me, who are doctors who are suffering from the disease. One of my inspirations is Dr. Brooke Goldner. She is a American doctor who is also diagnosed with lupus and is helping a lot of patients who are suffering from lupus. So I obtained my strength from her. I obtained strength from celebrities like Selena Gomez, who's also suffering from the disease. And maybe by doing this video, I would be able to provide strength for those who are suffering from lupus, especially for those who have heard the diagnosis for the first time. It's really hard, but there's always hope, and you'll get better. One day you'll wake up and things will get better. I have encountered patients who had to stop schooling, who had to stop their work, who had to literally stop their life because of this disease. But you know what? There is hope. The sun will always rise again tomorrow. One day you will be able to fulfill your dreams. Whatever you want to be a teacher, you want to be a doctor, you want to be a lawyer, you can do it. It's possible. It's just that we need to start from somewhere. We have that power to change, to actually improve our lifestyle, and so that we can improve our symptoms as well as improve or get better from this disease. And so to all those who have chronic diseases, I see you. I hear you. I understand you. It's okay if you're not okay today. It's okay if you're not feeling well today. It's okay if you're feeling pain, if you can't stand up. But don't worry, tomorrow is another day. There is always hope. God is there. God is good. I wouldn't be here right now talking to everybody, sharing my story, if I had not gone through what I had to go through. If I did not change my lifestyle, if I wouldn't be here right now. You know, God will always provide the answer. He gave me lifestyle medicine, and now He has given me this role. I am a lifestyle medicine specialist. I'm also a wellness speaker. I wouldn't imagine that I'll be a wellness speaker, talking to a lot of people and companies and sharing lifestyle medicine. How can they improve their lifestyle? Remember, you are in control of your health, your lifestyle, your life. You are in control of what you put in your mouth. Ask yourself, what happens after the swallow? Will this food nourish my body or not? You are in control of your physical activity, having time for exercise. There is time, you just need to be disciplined about it. You are in control of your sleep health. Having that 7 to 9 hours of sleep a day is possible. It's just that we have so many social distractions, and we just really have to be mindful and focus on our sleep. We are in control of managing our stress. Don't get me wrong, stress will always be there, something we can't avoid, especially at work. But how we react to stress, how we manage it, is within our control and reach. We are in control of removing vices, of smoking, of alcohol drinking. We are in control of our mental health, positive psychology, our connectivity with other people. We are in control. We are the boss of our lifestyle, our health, and our life. I empowered myself, and I hope that you will also empower yourself. This is the best time to actually improve your health. Through this pandemic, we have learned and we have realized that health is wealth. You have that power to change. It starts today. It starts with you. It is a gradual change. It will take a lot of hard work and patience, but our ultimate goal is to have that optimal health, that sustainable eating pattern, sustainable physical activity, sustainable sleep health, sustainable stress management, sustainable positive psychology and connectivity with other people, a sustainable lifestyle that is with the goal to have good health and better health. You can do it. You have the power. So I hope you learned something from this video, one thing or two that you would actually apply in your life and you would remember. I hope I inspired you to make healthier choices whether or not you are suffering from a chronic disease. Be the boss of your health, your lifestyle, your life. BOSS, building of self-sustainability. Empower yourself, and see you again next time in my next videos. Stay safe, stay healthy, and take care, everybody. Goodbye.